Wearing of face masks is one of the COVID-19 prevention protocols. WHO recommends the use of KN95 and 3-ply surgical face masks, but this is hazardous because improper disposal has led to the outbreak of the disease in many parts of the world. Now, nanotechnology. Completely unrelated, but still related. This is a nano mask. To understand about this, andamana nasi hadi tamati. My name is Samson Jura and welcome to this episode of TECHNOVATION Show, and today it is matters nanotechnology in medicine, and there is something called nanomedicine, and with me is Dr. Joseph Derito. He is a medical doctor, a human anatomist, and also a researcher in matters medicine. Well, to understand about nanotechnology, we'll get to talk to him, and of course he's also an innovator. He has come up with an innovation that will help us in fighting the COVID-19 pandemic. Stay with us so that you can get to know the type of innovation I am talking about. Dr. Derito, shukran sana kwa kutupatia muda wako siku hii ya leo. And first, without wasting any time, let's talk about nanotechnology and its involvement in medicine. And you being somebody who has invested a lot of time and resources in this technology, I believe you do have the expertise, and also your opinion does matter when you talk about nanotechnology and nanomedicine. Now, we all know, most of us, if not all, know that nano means the 1 millionth, the SI unit denoting the 1 billionth. All right. Now, how do you, since you are not stakeholder per se, but somebody who is into this, help our viewers understand what nanotechnology is all about and also how it's used in medicine.
Thank you very much. In approaching nanotechnology, let's start where you've mentioned about the 1 billionth. So, nano is it's a Greek word that means a dwarf. It means something really tiny, it's a measure of a dimension that is equivalent to 1 meter divided into 1 billion equal parts. So as a technology, it's a technology that involves the manipulation of materials at that scale. Materials that are so tiny, their diameter is 1 billionth of a meter. And at that tiny microscopic scale, this is a realm of atoms and molecules. It's so tiny, the way to picture it is like you take a human hair, which is that small, and its cross section you divide it into almost 80,000 times. That's how small those things are. And why that is important is because at that small scale, the physics of materials and their chemistry changes significantly, so that materials which may seem useless in normal everyday life when they are large, when they're divided into those tiny into atoms and molecules, the physics completely changes, and their behavior and interaction completely changes, so they can be manipulated to produce benefits that may not be possible in the larger scale. That's basically, in a nutshell, what nanotechnology is. And when you bring that, nanotechnology basically can be used whether it's in computing and in other technologies. When you integrate that with medical application, that's what now gives birth to nanomedicine.
So what would you say would necessitate the use of nanotechnology in medicine? You've mentioned that the way it is being used in computers is the same way that it be used in medicine to solve some of these particular problems that do arise. Now, you as an expert, tell us, what do you think, or rather, what are some of the reasons as to why someone or a researcher or a scientist would decide to use nanotechnology?
Now, nanotechnology it's a broad field, and those in computing will use it in very different ways. Those in other areas of material science have their own reasons for getting into nanotechnology. In medicine, the best way to approach it is you look around the world. We have so many problems in healthcare systems, some diseases that have no cure. antibiotic resistance, so that infections that were previously easy to treat are now not treatable because the bacteria don't respond to antibiotics, and some infections that we completely don't have any way to treat them. And one of the best, of course, as you mentioned, is COVID-19. So that means that if the science that's there in terms of biotechnology and the pharmaceutical industry has not given us a solution to those diseases that we're dealing with and the others that keep coming, then we have to look for solutions in this new field of nanotechnology that has a lot of promise, broadly in our fields of life. Therefore, the reason why a doctor would be interested in nanotechnology is when I'm in the hospital, struggling with the patient whose wound cannot be healed, or struggling with patients who have infections and we keep changing antibiotics and the costs keep increasing and there's no healing, and in the end we lose the patients, then you have to think, so what else is it that we can do? When we're dealing, for instance, with cancer, a lot of different types of cancers that have no cure, you have to wonder then, which is this thing that we can do to come up with a solution to help us find a different way of approaching this thing. And the other, something that is very common, for instance, diabetes mellitus, everybody knows somebody with that. And we have all these problems with its complications. So there are approaches in nanotechnology that have to do with how do we reduce the progression towards complication and death related to these diseases. Also, in something like diabetes mellitus, one of the biggest problems in managing diabetes is the patients have to inject themselves so many times every day, whether it's insulin or you're checking your blood glucose levels. It's problematic, and some of these people with diabetes are kids, teenagers in high school and all. So one of the other the advances in nanotechnology in the developed world is developing, for instance, systems that can monitor blood glucose levels without having to use those constant injections all the time. So nanomedicine, as I've said, nanotechnology for medicine, is where now the scientists are coming up with ways to improve what is already being done in medicine, as well as bring solutions to medicine that don't exist. You see, yeah.
Now we've defined what nanotechnology is and how it can be used in medicine, and how medical practitioners can actually use it in doing their day-to-day activities. Now, we've mentioned a couple of problems that are existent in the medical sector, and you've rightly put them, mentioned them and listed them down. So, in your time being a medical doctor and during your time doing the research and also research, yes. So what do you think are some of the products that can come out of nanotechnology that can help in medicine?
Now, the best way to answer that is let's think back. Rather, my way is that science is supposed to provide solutions to real-life problems in the society. And therefore, being a doctor, first, even before being a doctor, I was already a researcher, right? I was a human anatomist. I was traveling around the world with research and seeing how in developed world, technology is at the very center of everything they do in healthcare. And doctors are at the center of not just using these technological advances, but actually helping to develop them. And so, after being a doctor, for instance, let me say in real life experiences, as a medical intern, right, in 2016, I'm sent to the hospital, and immediately now, it's a shock, because now the decisions you make here could determine life and death for these patients, and I have to deal with situations where you're in public hospital. I was in a public hospital myself as an intern. The facilities are not there. Patients can't afford antibiotics, and a lot of them, when they can, those antibiotics are useless, because one of the biggest cases that I may give is chronic wounds. Maybe you've heard of people who have wounds that don't heal for months and maybe even years. So how we solve this problem is, and the way that my approach now, and the reason for, so it's good to say that my motivation to get into nanotechnology is first not only because it from when I was a kid or whatever, I've always just been fascinated with science. My life has always been just science stuff, right? But also the sense that, okay, these things that we're giving patients, they have side effects, they're not working, so what else can we do? And of course I knew from my wanderings around the world in science and all that, if we can develop products from nanoparticles, through nanotechnology, it's possible to develop a wound dressing, which when used on the wound, does not allow, or rather it destroys the bacteria and viruses and any form of infection around the wound locally there, and also enhances the cellular division that helps the wound to heal very fast. So a wound that would probably have taken a whole year to heal, maybe with a lot of hospital admissions and all that, might take just a matter of days and weeks. Because in that case, and then again, these patients don't have to keep on buying antibiotics. So we are also reducing, one of the biggest problem in healthcare is antimicrobial resistance. When every other organism starts becoming resistant to the medicines that we have, it's catastrophic to the medical healthcare, because without medicines there's no medical healthcare, right? So in order to reduce the progression to severe antimicrobial resistance, we need to reduce our dependence on antibiotics. The less we use them, the less likely that people will become, rather the bacteria will become resistant to them, and that gives us some reserve for whatever may come in the future. The other motivation, or rather utility, so one of the things I'm developing now basically is a product for wound therapy that involves using a nanomaterial to dress wounds and make sure, particularly now with focus on the chronic wounds, and make sure that now the patients don't have to use the antibiotics and all that. Now, wounds might sound like it's not a big concern, because everybody gets a wound every now and then, they heal and all that. But when you have compromised immunity, or in cases, I would say a hospital is all about wounds. If you don't go to the hospital with a wound, we are going to give you a wound. We give you an IV line, that's a small puncture, or there's going to be an operation, and sometimes the surgeons might do the best they can do. Do an operation very well, be very meticulous, reduce the blood bleeding and all that. But the patient goes back to the ward, and in the hospital wards there are a lot of resistant bacteria hanging around because of all the infections that are going on there. The patient maybe gets a surgical site infections on the wound there, and that can finally either complicate the healing process or maybe even kill some patients, right? The other factor is about also, if you look at everyday injuries in life, road traffic accidents, say even people in the military, who it's an occupation hazard getting serious wounds. So if a product like this comes out, it could solve a lot of problems that are affecting not only the healthcare system but the society as a whole. Another application of nanotechnology, nanomedicine, that is of interest to me, or rather one of the products that I'm working on is it has to do with critical care. Everybody now has been made aware about ICUs and ventilators. Last year we were all up in arms making ventilators at a time like this. We were all making ventilators and all that. And one of the biggest problem in ICU is the infections that people collect within the ICU setting itself. The way that I would explain it is, let's say most people right now are going to ICU with COVID-19, pneumonias and things like that. That is understandable. But there are a lot of people every day who are admitted in ICUs without lung infections. For instance, somebody who was just driving to work, healthy, they had a road traffic accident, they have lung injuries, they have head injury, and they're admitted to ICU. Those lungs were not infected before they went into ICU. And then now here comes one of the most feared problems in ICU, which is what we call, it's called ventilator-acquired pneumonia, which is that even in the best settings, the medical air still carries, it's not 100% sterile. It has some bacteria, it has some viruses. Now think about the fact that you're pumping this mercury into the patient's lungs through using the ventilator, and it's also a complex process that it might collect a lot of things along the way, and you're pumping it, let's say, 16 times per minute. In an hour, you've pumped a lot of volume, and the amount of bacteria in the end, the filter systems that are there in the life support system, they have not managed to reduce the occurrence of this ventilator-acquired pneumonia, so that globally, in the countries which are doing research and they have data, a quarter to a third of ICU deaths are directly related to ventilator-acquired pneumonia. Now, here's the key thing: if I can develop a nanomaterial which, upon contact, kills bacteria and kills viruses and kills fungi and kill all these infectious agents, and I can use it on the wounds, and I can use it in critical care. So this was my approach, years ago, years before COVID came and all that. And now COVID is here, and now it's like, oh, wait a minute, the masks that we have, we're still getting COVID.
Well, on that note, TECHNOVATION Show will be taking a short break. Remember to leave your comments and or suggestions on our social media handles at QTV Kenya, both on Facebook. Also, you can ask questions on our Gmail, that is technovationsshow2020@gmail. Well, on the second beat, we'll get to have an exploration of the Nano Mask with Dr. Nderi. To see you on the other side. Well, before the break, we did mention about the Tiira Nanomask, and with me, there are a couple here, but Daktari is the innovator, he's the face behind the Tiira mask. Did you get that? He is the face behind the Tiira mask. Well, we'll get it later. Anyway, Daktari, now take us through the anatomy of the Tiira mask. It's you've said it has got 2 layers. Take us through what materials are made and how they've incorporated the nano materials into the mask for it to be called a nano mask.
Okay, well, this is the Nano Mask here as an example. In terms of the reason that nano there is because the material it's made from is impregnated with nanoparticles, and that term impregnation means that the nanoparticles are forced through a reaction process where the nanoparticles become an integral part of the structure of the material itself, so that even if you washed it with a machine or whatever it is that you wash it with over again and again and again, the nanoparticles cannot come out because they're not coating the material, they are inside as part of the atomic structure of the material itself. Now, that's to say, for instance, this mask. The reason why, of course, everything for me is driven by a need. And as I said, after my bout with COVID-19 last year, I thought, why are we getting this thing? We're using double mask, we're using these non-reusable masks, we have to throw them away, we are putting 2 masks, 3 masks even. We have to go and see the patients. There's no other way. And of course, that's an occupational risk for a doctor that you're actually going to wear the COVID is. And so I wonder, wait a minute, why are we still using these masks and still getting these problems? And of course, part of what I came up with, because I had already been researching on nanotechnology, I'm like, wait a minute, I have technology that can create a material which is able to destroy the viruses and the bacteria upon contact. And now that's where now the idea of the nanomask came about. So that's a decision why I needed to use pure cotton fabric and linear flax, and because they have a very high absorption capacity, they have a good breathability, but most importantly, once they take in the nanoparticles and they become part and parcel of the material, you can rewash and reuse and there will be no effect to it, and the mask protects you also. That means also now this material, after developing the process of enriching, of treating that material and having it tested at the Ministry of Health lab, it's called the National Microbiology Reference Laboratory, and we were able to prove that in fact all the different species of bacteria that we are throwing at it, the material is actually killing them upon contact. Then after that now is about perfecting the process of creating that material, and I did my research. Then I worked with a factory, a textile factory, to create a specially made material for that work. And finally now is about stitching the nanomask, right? And its anatomy, basically what I wanted to achieve, and the reason why you see the shape is something which, it seals, it avoids the air escaping from all over the place, so that all the air that I'm breathing in has to go through the treated material. It's filtered, and the bacteria and the viruses and everything else that I'm breathing through is destroyed by the nanomaterial. And then and when I take out the mask, when I touch it, it's not going to transfer the trapped microbes to my hands because the nanomaterial has already destroyed it.
You have mentioned that the mask have incorporated the nanoparticles, as well as you've used cotton and linen, which is comfortable for anyone to use. Now, we know even our clothes, at times they're not in the same state they are in at the time we bought them, because they've been passed through water. We wash them using detergents and things like that. So for how long would somebody use the nano mask for until the time that you'd say you want to replace it?
Since a structural part of the fabric, not a coating, they're not affected significantly by washing. That would mean that then the material retains the ability to kill microbes for the entire life of the fabric. However, as a matter of precaution, we recommend that maybe if you've done about 100 wash cycles, that is, if you will not be washing it every day, or maybe you will be washing it every day up to 100 times, then at that point we could say maybe it has reduced its protection capacity by maybe up to 50%, or maybe something like, in science we say the decay rate of these things, so that maybe if you wash one time, maybe the decay rate is 0.1% or 1%. Now that is why we recommend, let's just recommend, instead of saying forever, let's say up to 100 wash cycles, whether it's machine wash or hand washing, and that would be so that we keep people protected. But of course, theoretically, it will retain its protection for the life of the fabric itself. Yeah. For those people who have reactions and you have difficulty breathing because of bacteria and dust in the bed, it can protect you from that. And it's also very important in protecting people from allergies, because one of the key roles of nanomaterials is reducing the agents, rather dealing with the agents that cause allergic reactions for people with asthma, for instance. So those are, it's not restricted in terms this is the only thing that we can make, or this is the only way that the mask can look like. Yeah. So basically, as I mentioned earlier, nanotechnology is about atoms and molecules and the way that we manipulate them at very tiny levels. So at the heart of, when you hear atoms and molecules, of course, what comes to mind is, physics and chemistry and things like that. At the heart of nanotechnology, of course, is chemistry and physics. How do you generate those atoms? How do you generate those molecules? It's all about reactions. And I'll show here one of the hypothetical chemical reactions. I'm not going to say that this is exactly how I've been producing my nanoparticles, but one of the key things that I started years ago is how, learning how do you generate those nanoparticles. This is a very small step. It's a multi-step process, but part of it is, as you can see, how do I come, mixing these different chemicals, each of which different elements, and they have different atoms. How do they react and all that? So if I can combine these, what appears to be a blue compound here in liquid state, and what is clearly a clear liquid here, which is in the burette here, and as you can see, it's already darkening. So if I combine them at particular concentrations, I expect a certain reaction to occur. So and the part that I had said about the marriage between high-level physics and high-level, in fact, we say it's quantum physics and quantum chemistry, right? But so that's why I needed to create this reactor, which I designed specifically for this work. It's because now these things, in order to go through the full process, have to be taken through exposed to very high pressures and very high temperatures, far above. Now this is occurring at atmospheric pressure. If you need to do a reaction at 3 bars, you can't do them in that condition. So some of the things that I can achieve with this reactor, it's still not the full process, but as you can see, for instance, here I can set the temperature. This is set here at up to 500 degrees centigrade, which is very, very high temperature. It would burn just about anything. And if I switch it on, you can see, so it's now in phase, so you can't come near here. And this is part of that is now this is controlling what's happening in this chamber. And this is, for instance, you can't touch here, it's very hot, right? And you can see all these different tubing and everything is basically the control systems and things coming in. Up here, things that are coming up here, for instance, would be like what I need to react with other factors, and in order to lead to the maturation of factors. So if I release the valves over there, then it will be taking the chemicals either in that direction or in this direction.
As usual, I hope you learned something new out of this episode. Remember to leave your comments and or suggestions on our social media handles at KUTV Kenya, both on Facebook and on Twitter. And also, you can fire questions through our Gmail, that is TECHNOVATION SHOW 2020. Until next time, keep learning something new each and every day. My good name is Samson Jura, and I'm out.